Hi, today we're here at the G-Spa to give a demonstration of how we do Botox for wrinkle reduction. We prefer to use Botox for wrinkle reduction because it is tried and true. It's been around a long time and we can always count on it. Botox is approved not only for wrinkle reduction, it's approved to decrease sweating of the palms and underarms and to alleviate migraine headaches, and we like it a lot here at the G-Spa. So Melissa's here today to help us demonstrate it. And where are you hoping to get your Botox today?
Well, I'm thinking that here in the round
glabellar area
would be really helpful, as well as around the eyes. The crow's feet area would be, I think, really a benefit to me.
Those are probably two of the most popular areas that Botox is used. It can also be used in the forehead. You can use it here to alleviate the so-called bunny's lines. There are many so-called off-label areas to use Botox. You can use it to get the little vertical lines. You can use it to help turn up the corners of the mouth, eliminate dimpling of the chin. There are a number of areas of use of Botox, but today we'll do her crow's feet and the 11s or glabellar area that a lot of women have. And at the G-Spa, we really like to make the procedure comfortable and help patients to relax through it. And so we take a number of steps to make patients feel more comfortable. One is we like to make the skin a little bit numb. So we're going to have Melissa use a little bit of numbing cream that we will apply ahead of time to the various areas and let that sit for 10-15 minutes, whatever time we have. And then a second thing we do is use the application of ice, and we have these little ice pillows that help a lot. And the third thing we use is a very tiny needle, a 32 gauge needle, which is almost acupuncture size. And so those three things help to make it a very, very comfortable procedure. So after she numbs up and we wait 10 or 15 minutes, we'll get started. So now we're back, and Melissa's skin is all numb, and I've wiped her skin off with alcohol. So she's ready for her Botox. So she's gonna close her eyes and get in her nice Zen meditation relaxed state. And I'm gonna just numb up the area with this little ice cube. Get it a little chilled, and that just kind of takes the edge off a little, so then she won't feel the needle stick hardly at all. Okay. And we're going to do the glabellar area first. Feeling a little cold now? Yes. Don't want to give you an ice cream headache, but I do want it to be a little bit numb. So let me have you give me a little frown there for just a second. Furrow your brow. Okay, that's good. Now relax. And the first injection is into the muscle. This is the procerus muscle, and then the other ones are the corrugator muscles. Melissa has had Botox before, so her muscles aren't as strong as maybe somebody that hasn't had it. So we're halfway done. And I'm going to just re-ice the other side a little bit. How you doing?
Fine.
Good. Just two more for this area. Breathe. Okay. It does look a little bit like one's had some mosquito bites, but those go away in 10 minutes or so. So you can often go back to work and nobody will notice that you've had anything done. Botox kicks in about 2 to 5 days. It starts to show its effect, and it reaches its maximum effect in about 10 to 14 days. So I always like to see patients back in 14 days to see if it's worked well and had an adequate effect. Sometimes we need to add a little bit more to get adequate relaxation and make sure we haven't had any untoward effects, which is rare, but sometimes that happens. So now I'm going to do the crow's feet area. We're going to numb up the tissue here. This hurts a lot less, actually, because it's a much more superficial injection. You have to watch for some veins in this area. I don't see, well, there's one big vein here, which I'll try very, very hard to miss so we don't get any bruising. And I'm just feeling for my landmarks here where the edge of her bone is. And we usually make about 3 different injection sites to do crow's feet. It's pretty standard. There's 1, 2, 3. Again, I'm going to feel for my landmark. Make sure I'm avoiding the veins. All right, you're all done. Okay.
Thank you.
So we'll see you in 2 weeks.
Okay,
All
great.
right. Okay.